RT's health correspondent Nicola Hill joins us now from London. Nicola, great to see you. Remind us of the importance of social distancing, especially as so many of our countries are opening up and so many people think it's over.
Yes, they do, don't they? But of course, social distancing or physical distancing was brought in right at the very start because they know that if you cough, if you sneeze, when you speak, when you sing, you're emitting droplets. And of course, if you're infected with COVID-19, these droplets contain the virus. And so anybody close to you can inhale them and become infected. Now, what they say is basically, is it 2 meters? Is it 1 meter? Now, some research that was published in the Lancet, it looked at 172 separate studies, and that decided that basically that 1 meter reduced the chances of you then becoming infected with COVID-19 by something like 82%. And for every metre after that, up to 3 metres, the chance is halved again. Now, as you said, some countries have decided that they want to have a 1 metre rule, some have 1.5 metres, and here in the UK, we have a 2 metre rule. Now, Professor Jonathan Reed from Bristol University, he says what we have to also take into account is things like temperature and humidity, because that will impact how far these droplets can go. I mean, they can actually travel at speeds of 5 metres per second or 30 metres per second, depending on whether you're speaking or whether you're sneezing. And the other things that you also have to bear in mind if you're indoors, is there a fan that can waft the droplets around, or if you're outdoors, is there a wind that can do this? But one of the things he says that's really important is it doesn't eliminate the risk completely. You know, it is just reducing the risk of you becoming infected.
So why is the choice of the physical distance still being debated?
I think it's probably because of this unknown. Now, as I said, the research that was published in the Lancet said that, 1 metre did actually reduce the chances of you becoming infected by 82%. This is because the large droplets, the heavy droplets, they fall to the ground after 1 metre. It's the smaller ones that then continue for 2 metres. And then we actually have something called the aerosol, which are the tiniest little droplets that can go further than that. So a lot of countries have decided that 1 metre is enough, it reduces the risk of transmission enough. And as we're easing lockdown, you can actually have offices open, you can have restaurants, you can have schools with a 1 metre distance. Other countries, like here in the UK, have argued for that 2 metre to really reduce the risk. But of course, businesses are saying that's just ruining the economy. We can't possibly open if we have to keep these big gaps. And in fact, it's not just businesses, it's things like the arts, like theatres, like plays. I mean, I heard Sir Simon Rattle, who's the conductor of the London Symphony Orchestra, a very prestigious orchestra, saying how on earth can his musicians play if they have to be 2 metres apart? The stage won't be big enough to have them all. So what type of music are they going to be able to perform in future? So that's why there's a lot of debate, there's a lot of discussion, and certainly here in the UK there's quite a lot of pressure on the government now to reduce that from 2 metres to perhaps 1.5 metres. And public health specialists say this might actually be what comes, what happens. But here in the UK, the government's still saying it's following the science.
And Nicola, we've seen the images of Black Lives Matter protesters. What are the risks that they're facing by protesting in such large numbers on the streets?
Well, this is something that a lot of public health experts and infectious disease experts are concerned about. Now, of course, the organisers of these protests have actually said to people, please try and keep that physical distance, please wear a mask, because as you and I have discussed, Maria, many times, we know that wearing a mask can also protect not you, but protect somebody else. So if we're all wearing a mask, we should be protecting each other. And the organisers have said, wear a mask, and we've seen lots of people in this protest have actually done that. But infectious disease specialists are worried, particularly because many of the people who have joined the protests obviously come from black and minority ethnic communities. And unfortunately, for reasons that are not completely clear, they seem to be more vulnerable to COVID-19. So the experts are saying that they completely understand why they want to protest, but to ensure that they do it very responsibly and try and keep the distances if they can do. But they're worried that maybe in a week, 2 weeks, we're going to see a spike in the numbers of infections in the areas where we've had these very big protests. And even if there have just been young people at these protests, many of them do live with older relatives. So there's a concern that they may well have gone home and transmitted the virus if they've picked it up to other people. But one of the things that Professor Reid said is they don't as yet know how much virus is in droplets, and they still don't know how much of the virus you need to be infected. There's a lot of research saying that if you're talking to somebody for 1 minute within a 1 metre distance, it's the same as talking to somebody for half an hour if you're at a 2 metre distance. So I think there's an awful lot of research that's still going to be carried on about this.
Absolutely, and still so many questions. Nicola Hill, thank you so much for that update.